That's real talk, though. That's what I said.
Hi,
Wanting to be
I'm
known
Dr.
and open
Shannyn
to
Fowl, and I have a practice in Mesa. I have a family practice. I see a little bit of everything. Mom and dad come in after the kid has come in. So I see a lot of immunology type issues, but I also see quite a few sexual issues because they come throughout the years. Sexuality is really a broad topic. It encompasses an enormous amount of ranges from behaviors to past experiences to beliefs, desires, and so forth. And it's a very important part of our life, and it's a significant impact on our quality of life, whether you're a man or a woman, whether you're young or wiser. Either way, it can have a significant impact on your quality and how you feel about yourself. So as a doctor, I have patients who are looking for a safe place to explore what's going on from a non-judgmental aspect. They want a physician who knows the risks of what they're going through, whether they're heterosexual, homosexual, transgender. And they want to be able to ask direct questions to get the answers they need, to get the information that they need. They want someone who knows the lingo, who can address their concerns. So I think that's very important. I often try to meet a patient where they're at. We all come from different backgrounds. We kind of have a kaleidoscope that we look through based on our belief systems, our experiences, and so forth. And we have to figure out what's healthy for each person. I do a lot of homeopathy. Most of you know what homeopathy is? Yes? A few people who don't? Anybody who doesn't needs a little explanation? Okay, it's a subtle medicine, really. It's a dilute form of a substance, usually a mineral, animal, or plant, and it kind of helps move the energy of that person in a certain direction. So in essence, they're stuck. And that's often when we see people is when they're stuck and they need help kind of moving in a direction. And so what's going on for them in their minds, emotionally, physically, can always give me clues as to what homeopathic remedy is really helpful for them, along with their belief system. So kind of helps them move in a certain direction. And sometimes they can change quite a bit of what they're thinking about. So I've seen people from really strict backgrounds, and I've seen people from really no boundaries. And so that can also create a problem. And the way that a person is raised, the way that they respond to the way that they're raised. You know, each interaction with a parent and child is just completely different because we're all individuals. So sex is with us kind of all of our life. Early on, sex is kind of an exploration. I've had kids come into my office who are, 2, 3, and they're kind of exploring their genitals more so than other kids their age. Kids vary in awareness, and sometimes parents just need reassurance. That's okay. Adolescents, middle age, they need education. They need someone who can create a safe place for them so that they know that exploration and discovery is okay for them. Trying to figure out what their orientation is, what their belief system is, not having to react to things. And someone to relate to. And I often tell my parents, it's a good time to practice talking to your kids about sex and drugs and all those other stuff when they're like 2, because then you get practice. And when the time comes around, you're not blundering over it, trying to figure out what to say. It's just common knowledge. Yes, this is an open family where we can talk about this kind of thing. This is a safe place where we talk about this thing. And I doubt anybody's here who doesn't really believe in that, because most people who believe that it's not an open discussion wouldn't be here. But I don't know, there might be 1 or 2 in the crowd. So I always try to, like I said, I always try to meet patients and families where they are. I try to respect their systems, try to respect where they're coming from, and if it's really harmful, then I try to offer other options of how to think about things, and they can take what's going to work for them and leave what's not. In the 30s, we're starting to have children and having more issues with being exhausted and libido issues, hormonal issues, and that's more libido issues more in women, and men you see more. I've seen a few spinal injuries and seizures, those kind of issues that can affect medications. Can often, on my little handout that I have here, I have common medications that can cause sexual dysfunction, common medical conditions, and the common sexual concerns that usually come into the office. What are the big issues? Pretty much everything, every concern can kind of be lumped into one of these headings. And then I also have a box of common sexual myths, what we tend to be told and what's really true. And this can be helpful in a relationship. It can be helpful in teaching others. So oftentimes with libido issues, I find that it can relate back to an adrenal issue. Adrenals are what we use to put out our stress hormones. The ovaries also put out stress hormones. So if you've had that shift, whether having kids and now getting up in the middle of the night and so forth, it can throw the stress hormones off, and so you need a little bit of love for the adrenals, and often when you do that, the libido comes back. It's not such an issue. But there's also a lot of emotional issues, as have already been touched on. Emotions are molecules, and they run around inside our body, and if we don't eliminate them, they end up somewhere. And when it comes to relationships and intimacy, a lot of those tend to get stored right in our vaginal area. And so you see people who have, I've seen some women who have vaginitis that hasn't been diagnosed. They've done all the swabbing and tests and GI tract tests and so forth, and not getting a whole lot of results because it's more of a functional thing. It's where the emotions are being stored in that tissue. People have vaginal spasms constantly, those kind of things. Often related. I have one woman who has that chronic spasm and vaginitis issue, and she's willing to do anything, just anything, but she's not willing to talk about her past relationships and the sexual issues that are surrounding. And there's something going on because she's had a boyfriend for a very long time but hasn't had sex. And it's just an interesting thing. It's so sensitive, And so it just goes back to, I know that she would get some results if it was, eventually she'll be able to, but it's just not the time for her. So I have seen that our vagina can be one way of eliminating things. Actually, ejaculating is a way of eliminating things. And whether it's energy or toxins, it's a way that the body gets things out. And so in some of the religious communities, you can find that there may be a higher incidence of BPH and those sorts of things. Or even, I think there's been a study in monks where they found a little more common of that because they're not as free to eliminate. So ejaculating and having orgasms can be has its benefits, can be a healthy part of life. So then we get into the 40s, and that's the top time. Men, this is very important for you to know. The 40s is when women are at their peak libido. Good thing to know. And menopause, this is right around the time that menopause comes in, and studies are showing that the menopausal changes are not so much a factor in the change of your orgasmic quality. Wow. But it's more the mental health. So getting down to the nitty-gritty of what's going on as far as in your relationship, in your intimacy, in your mood, what exactly is going on. And that's not to say that it's all in your head, so to speak, because we do have some issues like hypothyroid and anemia and vaginal dryness and those sort of things that do need to be addressed. Addressing the causes is important, and sometimes it can go a lot to the mental health realm. So, thank you.